that doesn't know any geography, doesn't know any culture, background, ethnicity, sex, gender, it hits us all. People don't go looking for medical debt. In fact, it's one of those things that you're quite surprised to have to deal with suddenly, and it finds you when you have no other choice. That's the nature of medical debt. And we can all agree that everybody should pay their bills. Of course, I believe in that. And Minnesotans want to do so, and they try to do so. But when our debt system, punishes people with crushing debt just for getting sick, managing a chronic illness, having an accident, or being diagnosed with a catastrophic illness, it forces them further into debt just so they can afford the essentials for their families. Medical debt is different. And we can all agree that no one should ever have to choose between affording their lives and affording to live.
That's right.
So last year we took some big steps, and much thanks to many people assembled at this table right now. We had an amazing coalition of people who advocate for folks facing cancer, ALS, MS, people who represent immigrant groups, labor groups, business groups, people in government, municipal leaders, like the Mayor Carter, legislative leaders, Senator Bolden, Representative Ryer were our champions in the legislature, and we assembled a great group, and we passed the Debt Fairness Act. Now, the Debt Fairness Act is the law.
That's right.
And no Minnesotan will be saddled with a spouse's debt, medical debt after that spouse has passed. No Minnesotan will be denied medical treatment because of their old hospital bills. No Minnesotan will see their credit card or their credit wrecked by medical debt they couldn't plan for because medical debt can no longer be reported to credit agencies, and that's a good thing. The Debt Fairness Act was a big win, but even as we celebrated, we knew we had more to do. And so we're here to do it. We knew we needed to find ways to help many Minnesotans who are carrying medical debt they just can't pay back. And that eats away at their ability to afford their lives. So today, we're here to introduce the Minnesota Debt Reset Act, an effort to relieve an estimated $500 million in medical debt, impacting the lives of as many as 400,000 Minnesotans. We're partnering with Undo Medical Debt, thanks to them, and an organization that buys and abolishes medical debt for people experiencing financial hardship. And with the leadership of Senator Bolden and Representative Ryer, who championed the Debt Fairness Act last year, and they are leading us again on the Debt Reset Act this year. Thank you all very much. Is it okay to give y'all a hand? Thank you. This bill, the Debt Fairness Act, would not only be a victory for was not only a victory for struggling Minnesotans, and this Debt Reset Act is not only a potential success for potential Minnesotans who didn't ask to get sick, but it would also be a victory for hospitals carrying debt, helping them fulfill their commitment to community well-being, while also getting debt off their balance sheets that they might not be able to recover otherwise. And it would also be a victory for every community in Minnesota, because when one of us can get necessary medical care, all of us are a little healthier. So let me just say, the Debt Fairness Act went into effect last October. I promised all of you that debt would remain a priority for this office as long as our debt systems are getting in the way of Minnesotans being able to afford their lives and live with dignity, safety, and respect. But that's exactly why we're back here today. The Minnesota Debt Reset Act is the next phase in this important body of work. And today we'll hear from people leading that work: Senator Bolden, Senator Ryer, entrepreneur and business leader and board member of Undo Medical Debt, Jeff Smedstrud, our wonderful and courageous Mayor Melvin Carter, and Jen Schultz, who has confronted cancer and is so far doing pretty damn good with it. I'll let her tell the good news if she wants to. But bottom line is, we're still in this fight, and we're going to stay in this fight until we help Minnesotans afford their lives. So with that, Senator Bolden, step right up.
Thank you very much. I'm Liz Bolden. I serve in the Minnesota Senate. I represent District 25, which is most of Rochester and some areas north of Rochester. I'm also a registered nurse. I am incredibly proud of the work that we did last session with the Debt Fairness Act. In fact, I spoke to a couple in my district a few months ago who said they moved to Minnesota specifically because of the Debt Fairness Act. I'm incredibly proud of that work, and I'm incredibly proud to continue the work around medical debt. And just this past week, had this Medical Debt Reset Act introduced in the Senate. So I look forward to this work because of the huge impact it will have on Minnesotans. As was said, medical debt is different than other debt. It is not something that people expect or plan for or ask for. It could happen to any one of us at any time. And the weight of medical debt that is on folks' shoulders is in every corner of our state. I think about patients that I take care of in terms of medical debt. I think about a young woman who I recently met who has congenital heart issues, so has been dealing with the healthcare system her entire life and has the medical debt to prove it. She has resigned herself to never owning a home, never having children, because she won't be able to afford those things in her mind. In fact, she was worried in the next few months about becoming homeless because she was concerned about and looking at how am I going to be able to continue to afford my rent because of my crushing medical debt. I think about a patient I recently took care of, a middle-aged woman who was planning to put off her routine cancer screenings and her routine medical care because she was carrying medical debt and did not want to incur any more bills. So she was just making the choice that she was not going to take part in those cancer screenings, knowing that that puts her at risk, but not wanting to continue that heavy weight of that medical debt. I think about the young man I took care of in the hospital who had a car accident and had multiple surgeries after that, and was not focused on his recovery and wellness because he was so overwhelmed with the costs that he was incurring in that moment in the hospital. And so we have an opportunity, while there is ongoing work to transform our healthcare system to one that is focused on care and not profits, and I am dedicated to that work and will continue that work. And we have an opportunity in this moment to lift some of the burden, some of the weight from people's shoulders, from Minnesotan shoulders who are carrying that medical debt. And so we have an opportunity this session for $5 million to forgive $500 million of medical debt for Minnesotans. I am dedicated to that. I look forward to continuing this work as we move forward this session because of the great benefit it can have for Minnesotans. And with that, I will hand it to my partner in this work, Rep. Ryer.
Can you get your first and last name and spell it, please?
Yep, Liz Bolden, Lizboldon.
Title?
State Senator, District 25.
Hello, I'm Liz Ryer, representative from District 52A, Egan and Burnsville. Last year, we made major strides in protecting people from some of the worst abuses of medical debt. The Minnesota Debt Fairness Act protects people's credit, ensures they can get care even if they have medical debt, and much more. But these reforms only help with part of the picture. As people recover from their medical problems, they're saddled with ongoing debt. Debt they never sought, didn't plan for, and may not have the means to repay. Anyone who's lived through this knows the effect it has. Shame, anxiety, depression are common. Care is delayed to avoid accumulating more debt, and health may decline. This increases the cost of care, and we all pay for that. I know the impact of financial problems. I've been afraid to answer the phone while the bills piled up. I watched my mom go through that, forced into bankruptcy when she couldn't pay my dad's final medical bills. That's why I'm so excited to be bringing forward the Minnesota Medical Debt Reset, working with undue medical debt to buy down hospital debt. This brings our reforms to the next level, freeing eligible Minnesotans from this ongoing burden. Just think, to open a letter informing you that your debt has been purchased, instead of more pressure to pay, you find that the money you owe has been forgiven. This stress is gone, and the pressure you've been living under is eased. And I admit, when I first heard about this program, it sounded too good to be true. And I'm so pleased to see that it's real, it's highly rated as a nonprofit, and it works. Medical debt has become an unfortunate feature of our broken healthcare system, no matter where you live. City or country, north or south, Minnesotans in every community face the problem of medical debt. And when talking to constituents, even those who don't personally need this help right now relate to the value it brings. It's a program that only has winners. It helps people, and it also helps hospitals. They receive a portion of the amount they're owed rather than writing off 100%. And each dollar investment has a tenfold payoff. $5 million invested would retire about $500 million in debt. Senator Bolden, Attorney General and Ellison and team, Mayor Carter, thank you for your partnership. And finally, thanks to the Undo Medical Debt team. Working together, we can continue to build a better healthcare system for the people of Minnesota. Thank you.
First and last name, please, spell it.
L-I-Z, Liz Ryer, R-E-Y-E-R, Representative 52A.
Thanks.
Well, my name is Jeff Smedsrud, Jeffsmedsrud, very Norwegian name. I'm a national board member and a volunteer for Undo Medical. My thanks to the Attorney General, Mayor Carter, Liz, the coalition that they are building, and especially those who step forward today and at other times to share their story about how medical debt has impacted their lives. I was born and raised in a small Minnesota town. I'm a cancer survivor and someone who has dealt firsthand with the difficulties of unexpected medical debt. I'm not ashamed to admit it. No one should ever be. Medical debt causes people from all walks of life to feel less than instead of equal to. It happens by random chance: cancer, a heart attack, premature baby, an accident where you're making decisions to save a life with seconds to spare. No one can predict it, no one can plan for it. Erasing medical debt is not just about justice and equality, it's equally about jobs and economy. When unexpected medical debt happens, people become locked in their own private recession. At a macro level, in a recession, money is often spent to stimulate the economy. The goal is to spend the fewest public dollars possible to get the greatest effect, creating more consumer buying power, which in return ends up with more tax dollars. Writ large, by using private and public money to relieve medical debt, we help people remove a barrier to care, as well as helping them financially and emotionally. They pay less interest rates on credit cards. They consider starting businesses, which create jobs. They utilize health care at the front door, preventive care, instead of at the emergency room. And they're freed up from that debt to spend money on consumer goods and services subject to a sales tax, and so you get the money back almost immediately. So let me tell you a little bit about Undo Medical Debt. It was started just over 10 years ago by two former debt collectors. Undo Medical is a 501c3 nonprofit. We buy medical debt in tranches from hospitals, providers, collection agencies, and many other groups for pennies on the dollar. Normally, 1 penny equals $1. We then raise money from individuals, businesses, churches, nonprofits, and lately in partnership with state and local governments to cover the cost of the debts that we purchased. Finally, we then mail letters and reach out to the individuals, thousands at a time, to let them know their debt is erased. The credit bureaus have been notified. Their credit scores usually are improved, and they feel better about themselves and more spirited about their community, and it has such a positive impact. Inception to date, we have erased more than $15 billion, impacting roughly 8 million consumers. Our criteria to erase medical debt, which will be used in Minnesota, is twofold. First, you must be below 400% of the federal poverty level. That's roughly $60,000 for an individual, and I believe about $120,000 for a family of 4. And second, the debt must be more than 5% of your annual reported income. Now, Minnesota is not the only state to tackle this issue. Initiatives like this are ongoing in Arizona, Connecticut, Illinois, New Jersey, Ohio, Pennsylvania, Rhode Island. As a Minnesotan, I happen to think we're doing it best. So if you have medical debt, understand you are 4 times more likely to be in default versus if you had an auto loan. You're 3 times more likely to have mental health issues. Medical debt in Minnesota and elsewhere is more prevalent in rural communities. It impacts veterans more than those who have not served. It impacts ethnic communities. It impacts females. It impacts those under 30 way more than those over 40. We have a societal impact and an economic impact to allow these people to get back into the economy. As I mentioned, I've felt the pain and I know the relief that comes from investing funds to reduce medical debt. I've invested personally funds to erase about $9 million in medical debt over the last few years. Others have done much, much more. There is a coalition of faith-based organizations in Minnesota that has raised and contributed enough money to wipe out close to $100 million of medical debt. So I want to thank the sponsors of this legislation. Erasing medical debt is important, but so is creating ways to prevent future debt. And together with creative thinking, we can make Minnesota the first state, I hope, to be a medical debt-free zone. It would serve us all very well, and we are on the way with the leadership that you've heard today and the community and the organizers. So thank you for taking that first step to create hope and belief for hundreds of thousands of Minnesotans.
Thank you, Jeff.
Well said, Jeff. Thank you so much. Good morning. I'm Melvin Carter, the mayor of the city of St. Paul, Minnesota. MELVINCARTER. Indeed. Thank you so much for that introduction. Thank you so much for the work. Thank you so much to our Attorney General. We appreciate your leadership, the powerful Legislative Liz Caucus. We appreciate you guys, you both taking the lead on this and helping to move our community forward. I agree with you. When I first learned about undue medical debt, it seemed too good to be true. But then I remembered an experience we just had in St. Paul just a few years ago. I was sharing with the Attorney General earlier. In St. Paul, in my first year as mayor, we made the decision to eliminate library debt. And I share with folks all over our community all the time that the reason we did that is because library debt doesn't do what we thought it did. We thought library fines makes people bring books back. What we learned is library fines make people stay away from the library. And we've been in a lot of different types of rooms, and we've had professionals and different folks say, yeah, I know what you mean. And so we eliminated library debt in our city. And the important part is that immediately we saw a number of people, we saw double-digit increases in library use, focused in all of our lowest income neighborhoods in this community. And so for those who look and say, you know, this looks too good to be true, we have good news, and that's that we're already doing it in St. Paul. We started this journey a couple of years ago, and we have already issued relief for just over 32,000 St. Paul residents in the amount of just under $40 million. And we've worked with Undo to do that exact same work. But even more importantly is the understanding that if library debt is keeping people away from the library, then what do we think medical debt is doing? Medical debt serves as a barrier to health care in our community. There's not a day that goes by when I don't meet someone who remembers the pandemic that we just went through and understood the lesson of that pandemic, and that is if my neighbor can't go to the doctor when they're sick, when they have symptoms, then I'm less safe. This is about freeing St. Paulites, freeing Minnesotans from the crushing debt, from the crushing burden of a debt that, as they've been mentioned, nobody signed up for. Most folks would have rather never to have had to take out in the first place. Debt that exists as a reminder, oftentimes, of some of the most painful and traumatic moments in our residents' lives. And this debt is something that our residents deserve to be out from under the weight of. But even more, this isn't debt that we're relieving for those people. This is debt that we're relieving because it makes our communities stronger. This is work that we're doing because it makes our communities safer. It's work that we're doing because when we eliminate barriers for our neighbors to go to the hospital, to go to the doctor, to get those well-child visits, to get their routine maintenance, we make our own children more healthy. That's what this work is about. And so I am pleased to be a part of this work. I'm pleased to have engaged this work where St. Paul is concerned. I should tell you that as folks thank me for the work that we're doing, I oftentimes make sure that they know that the work that we're doing, I get to say we because I'm the mayor, but in truth, the work that we're doing is oftentimes done by our team in our Office of Financial Empowerment. Casey Wiedrick is here with us. Thank you for your work on this. And since we've done it, I've heard from residents all over our community. I've heard from parents. I've heard from grandparents. I've heard from people who have been recipients themselves. We hear about the young lady who was diagnosed with an ectopic pregnancy without the means to afford critical reproductive health care. We've heard from a brave individual who entered treatment for drug addiction at just 19 years old and has since remained sober, all while pursuing a career to support those struggling with chemical dependency. We know for all recipients that the care they received was necessary and life-changing. But after all those hardships, after surviving drug addiction, after surviving an ectopic pregnancy, after surviving cancer, you shouldn't be faced with crippling medical debt as a remnant of that. As you heard from our Attorney General, no matter our circumstances, good or bad, there are circumstances that we can't always plan for. As I've said it before, when our neighbor struggles, we struggle. We have to understand that we live in a space. I see the homages to Reverend Dr. Martin Luther King in this space, and I remember his words that we live in this inescapable network of mutuality in which what impacts one directly impacts all of us indirectly. This is about building community. This is about ensuring that everyone in our community, every Minnesotan, every St. Paul resident, every person can access the care they need, get the answers they deserve, and trust the care they receive. One of the most powerful moments that I've experienced since we launched that work happened last month. I was finishing a meeting, and a woman named Jen Schultz walked up to me at the end of that meeting and said, "Hey, you don't know me, but I just want you to know my story. I'm a cancer survivor. I've been cancer-free for almost 3 years at the time." She said, I've been cancer-free, but I've had this bill hanging over my head. And I wanted you to know that I'm one of the recipients of St. Paul's Medical Debt Reset Initiative. And it's so powerful for me to hear that story. It was so powerful for our community to have Jen share her story that we wanted to make sure that you got a chance to hear it directly from her. So I want to introduce Jen. Thank you so much for being here. Thank you for your power. Thank you for your strength. Thank you for your courage and your willingness to share your story. I'll get out of the way and say congratulations. Will you share your milestone, or can I? You share your milestone. And we're happy to have you. Thank you so much.
Okay, well, good morning. He wasn't supposed to make me cry before I came up here. But as he mentioned, I am Jen Schultz. I live in St. Paul, and I am a 4-time cancer survivor. I was diagnosed with melanoma in 2015, just 2 years after graduating college. And my news, which he sort of previewed, today actually marks my 3-year anniversary from my most recent diagnosis. Okay. Thank you. So despite being 3 years into survivorship, the financial burden still very much remains. Whether you're a cancer patient or a survivor, the costs associated with ongoing care add up quickly. We have oncology appointments, scans, biopsies, ultrasounds, medication, treatment, and on. The burden of medical debt doesn't just impact us, it impacts our communities, our families, our friends. I often feel dependent on others and have had to ask for financial support more than once. There are weeks when I still have to choose between filling my gas tank, buying groceries, and making a full payment toward my medical bills. Representative Ryer asked you to imagine what it's like to fear going to your mailbox, and I don't have to imagine it, I live it still today. It's important to note that I was fully insured throughout this entire 10 years. A recent survey of cancer patients and survivors done by the American Cancer Society Cancer Action Network found 98% of respondents were insured at the time that their medical debt was incurred. I was so grateful to receive a letter in the mail from the city of St. Paul, that was a good mailbox day, sharing that a portion of my medical debt from back in 2018 has been erased. It's hard to find the words to express how much that means to me, which is why I am really excited to share today my support of Representative Ryer and Senator Bolden's bill to do the same things for Minnesota across the state. I want to thank both of them, as well as Attorney General Ellison, for their leadership on this issue. The legislature has an opportunity to provide real support for Minnesota's patients, survivors, and their families. Compared to our state budget, this small investment can lead to a huge relief for hundreds of thousands of Minnesotans. Nobody chooses to fall into medical debt. I never chose to have cancer 4 times, and medical debt should not be a side effect of my cancer diagnosis. Thank you.
Thank you, Jen.
So Jen is with 2 N's, Jenn, and then my last name is Schultz, Schultz. Thank you.
We got time for a few questions if y'all have them.
Jen, could you stay there and say, did that letter, was it completely out of the blue, or were you aware of the program before the letter arrived?
I was aware of the program, so I had seen on social media, like most people my age do, that they were doing that, and I knew that 32,000 people were doing it because of, I have 3 jobs, so I thought it was probably going to be a long shot for me to actually qualify because of my income status, which I guess speaks to probably the level of medical debt that I'm in. I was actually on my way to an oncology appointment and stopped at the mailbox on the way to go out to my mom's car and I saw that it looked like what I was hoping. So I was a little afraid to open it, put it up to my forehead, said a little prayer, and then started crying when I opened it. And my mom, who had no idea what was going on, was like, "What is happening?"
Jen, you still have debt.
I do. That erased my debt from back in 2018, which I think also speaks to the significance of, I'm not even sure I knew that I still had debt from 2018, so it's very easy for medical debt to fall between the cracks. When you get medical bills, they often come independently, so I usually have like 5 or 6 payment plans going at a time.
Jen, do you mind giving us kind of a ballpark how much debt we're talking here?
Whew. It's hard to say. I have 2 ER visits that actually haven't even hit my mailbox yet. Well, maybe they have. I haven't looked. Definitely into the thousands, though, for sure.
I was just going to share, to be clear, that's our first tranche of debt forgiveness in St. Paul. The first tranche that we did was in partnership with Fairview. I appreciate the story because part of the way this works is people don't, when we announced it, people said, how do we apply for it? And that's one of the beautiful things. Oftentimes, some of the great programs that we build in spaces like these, we create these kind of significant application processes that end up being the barriers that keep people away from them. There is no application. We're working directly with the hospital systems to identify literally everyone who qualifies, to knock down all of it. And so hopefully we'll get you another one of those envelopes pretty soon as we work with the other systems.
That'd be awesome.
I would also like to say, too, when it's constantly coming in, because even though I am cancer-free, I still have multiple appointments a year, and that's even when I'm healthy without scans, biopsies, and things like that. So even just a small, like a $25 bill being paid would seem really significant to me. Like anything that can be erased is really impactful.
I have a question. I don't know if it's for Jeff or one of the lawmakers, but in the universe of medical debt, there are bills like that where people are still actively trying to pay, and there are some bills where people have forgotten they're there, and frankly, so have the hospitals there, and they're just going to write them off as medical debt. If we were going to get bang for our buck, we'd figure out the debts that are still active. I'm just wondering if there's any way to differentiate the bills where we'll get that economic impact you're talking about, or if we're going to pay off some where really it was just going to be the hospitals writing them off as bad debt, and now we're paying them as taxpayers instead of the hospitals.
Well, I think right
Come
now,
on, man, excuse me.
from Undue Medical's perspective, the research and studies that we've done, we are able to demonstrate there is some correlation between the debt forgiveness that we're doing and some form of economic stimulus. It's really a case-by-case basis, but all debt forgiveness is a positive step, and nobody is deadbeat in this. We are all struggling with something we didn't expect to happen to us. My story from 20 years ago, I had colon cancer, and it happened in Q4, and treatment was in Q1, and I ended up hitting 2 deductibles, $17,000 of medical expenses, and I managed to power through. I was starting a business, and every day I'd go to the mailbox and hope I didn't get a letter from a debt collector, because raising money to start a business, you can't have that on your record. So it's hard to be precise which debt is the most impactful, but it all has an impact.
And if I could add on to that, because I think this is an important point. When a hospital or provider has debt that they deem to be what they're going to send to collections, they've already decided that their internal capacity to collect that debt is exhausted. And so the idea that this is uncollectible bad debt and this is collectible debt, it's sort of on the company that generally are in the industry to see what they can get. They buy it at a discount, and then they buy it for pennies on the dollar, but try to get the whole dollar from people like Jen. So the idea that there's some bright line between bad debt and collectible debt is a little bit, it's so highly subjective and speculative that we're just stepping into the shoes of the industry player, and instead of saying give us the whole dollar, we're saying go lead your life.
That's right.
So I don't know. Yeah.
That's right.
I'd also just like to add is that I don't think people are likely to forget that they have debt because it weighs on you. People feel responsible for the debt they have, whether or not they chose it. And so I think there's an emotional, psychic burden for people when they are facing that, even if they're not thinking about it every day. And the relief of having it go away, I think matters. Even if it doesn't change behavior in the short term, it matters to making that person whole.
I have a question, I think another undue medical question.
I'm sorry.
I know we have the estimate that the
I
5
want you over here,
million-
Jeff.
Yep.
I'm sorry.
I know we have the estimate that the 5 million could cover 250 to 400,000.
Mhm.
Do we have an estimate for how many total Minnesotans are suffering from medical debt?
This $5 million initiative will help 250 to 400,000. It will go a very, very long way towards making Minnesota as close as possible to be a medical debt-free state at a moment in time. We estimate there's probably another $150 million of debt, but it's kind of hard to track and know with precision. This will go probably farther than any state has gone to make medical debt as small as possible. Not 100%, but within the ballpark of getting really, really close.
How do you figure out who qualifies? I mean, do you have tax information to figure out how a family has an income that meets their criteria?
We see that data from providers. We see that data from debt collectors when we buy tranches of data. If it shows up on the data that they give us when we buy the medical debt, we use that information. And if it says they're under 400% of poverty level, that's what we use.
And are there any providers that you don't contract with or do business with in Minnesota, so that would be the gap, like you don't do it with?
There's nobody we say we are not doing business with. Different providers look at debt issues in different ways. We work with all of them to try to find some common ground and do something good together.
I think we've probably got time for one or two more questions.
Do we foresee this getting bipartisan support?
We definitely. Well, I'll let the authors say.
I certainly hope so. We're actively having conversations, and I think there's definitely opportunity and room for that. As we have said, this is an issue in all corners of our state, in every district in our state. So absolutely there's opportunity for that, and we are actively having those conversations.
There's bipartisan medical debt. I think we're about there.
I have something for you and the mayor.
Is it on this topic?
Everything's on this.
I know, but so I don't want to distract from this issue.
Okay.
So if you want to talk about something else, can we talk after? Or I'll just stick around, but
Yes, if you.
I don't want to hold folks
That's
up.
fine.
So any more medical debt issues?
Is the fiscal note around that 5 million figure? Okay.
Pretty straightforward. Well, men and women of the press, thank you very much. Yeah, and thank all of you, definitely.
Thank you.
I think they want to talk to us. All right. Ow. Ow, you guys.
So,